Would you be able to visualize snoring? Not just listening, but seeing what is happening there. The moment you are snoring, the moment you are having obstructive sleep apnea. Well, yes, I will show you about this exam, the endoscopic sleep. What is this exam that visualizes the place where you are snoring and having obstructions? Well, my name is Tiago, I am a doctor, I am a rhinitis here in Belo Horizonte. And I'm going to tell you everything about this exam, endoscopic sleep, what it is for, how it is done. And you will see an exam that I do in an exam. Well, first people have to know if they have or not apnea. And what is apnea? Apnea is that 10-second breathing stop that happens during sleep. And if you have more than 5 apneas per hour, you have a disease called obstructive sleep apnea. So, the apnea diagnosis is given by polysomnography, which is an exam you do at the clinic, you sleep, monitored, and there you will know if you have or not apnea. Endoscopic sleep is different, it will visualize during sleep, a person who is already diagnosed with obstructive sleep apnea, what happens to the throat, with the pharynx, which is where it obstructs. I have a video here showing why people snore, how it is done, what happens, this vibration. Here today we are going to talk about the exam, endoscopic sleep. Well, the question here is, if you already have apnea and went through some treatment, or have to do some treatment, do some surgery, put some device that will advance your jaw to avoid snoring or apnea, you may need endoscopic sleep to visualize which is the best treatment and what to do if you are or are not a candidate for surgery. Well, there are several treatments for obstructive sleep apnea, and that does not compete here in this video. Here I will talk about endoscopic sleep, which is an exam that will film the throat, the pharynx, which is where the obstructions occur. Well, how is this exam done? This exam is a little probe through the nose, with the patient sleeping, monitored, with the anesthetist on the side. He will do a medication that will simulate natural sleep. So we go through the nose, an endoscopic exam. This endoscopy, it goes through the nose and will come and film the throat. There in the throat is where the obstructions occur, the obstructive sleep apnea is given in the throat. The snoring is the vibration of this channel and the sleep apnea is the obstruction of this channel. And we, with this little probe, we visualize the place where these events are happening. Let's see this case here, for example, look, we can see here where the snoring is happening, where the vibrations are happening. Then you look here, I will put the sound here of the snoring, and you can see where it is happening. And then, knowing where the place where it is happening, you can act, doing some surgery or some procedure. Look at this other case here, which is an obstruction. Here you are visualizing the pharynx closing, the pharynx obstructing. And you will have the respiratory stops, which if it lasts more than 10 seconds, will be classified as an obstructive sleep apnea. This can happen several times, more than 30 times, it is a serious obstructive sleep apnea, more than 30 times per hour. And then we can use a maneuver during the exam, the person is sleeping and a doctor is filming there, the other will slightly pull the jaw forward and visualize if he can get her obstruction. Look here, in this case here, when I pull the jaw, the patient unobstructs the pharynx, sometimes even stops snoring. And then we can know if this treatment, throwing the jaw forward, can be a treatment for obstructive sleep apnea. Sleep endoscopy can even be useful to know why the CPAP is not working. Who does not know, CPAP is this little device here. I will leave a video here talking all about CPAP, how it works. In some cases, some patients may not improve with the therapy, with the use of CPAP. Rare cases happen, the cases that happen, we can put the CPAP with the person sleeping, make this little probe, pass the NAS, which is this video that will film the throat, with the use of CPAP and check what is happening, what is not working. In other words, sleep endoscopy has several indications. It can be useful for those people who are candidates for surgery, a surgery in the bones of the face or a surgery in the throat. It can be indicated for those people who need to use a device, an odontological device, that puts it at night to advance the jaw and thus to obstruct the throat and reduce snoring and obstructive sleep apnea. It can be used for people who use CPAP and are not adapting very well, or simply to visualize the throat region and check if there is any treatment that will be better indicated for this patient. Sleep endoscopy is nothing more than a filming of the pharynx, the throat, during sleep. Some maneuvers are performed to see if that changes, and it is not to diagnose, it is not to know if you have or do not have apnea, it is to know where the events are happening, how they are happening, and what we can do with this lordo so that you have a more effective treatment for obstructive sleep apnea. And if you got here, consider subscribing to our channel, activating notifications, and leave your comment. If you have ever performed a sleep endoscopy exam, if you have ever done a treatment that did not work for obstructive sleep apnea. See you in the next video.